The most high-performing firms are differentially good at hiring and retaining productive workers. However, when researchers analyze this phenomenon, they typically think of workers' skills and knowledge. What they overlook is a key human capital attribute that creates value: employee health and well-being. The idea that healthy workers produce more goes back as far as Adam Smith. And extant research shows that improving employee physical and mental well-being can increase productivity. However, firms have been slow to put this knowledge into practice. One way firms can invest in employee health is by providing health insurance. With access to health insurance, workers are less likely to leave their jobs, more likely to access preventative care, are better able to manage chronic conditions, are less worried about the costs of healthcare, and are less likely to experience anxiety and stress-related disorders. Employer-provided health insurance is in high demand and encouraged with very large tax incentives. Yet, only 25% of small firms offer health insurance to their employees. So, when does it make financial sense to invest in health insurance? So, to answer this question, a team of researchers led by Ulya Tsolmon analyzed data from 15,000 small firms in the US and found that firms are more likely to offer health insurance when external frictions are low, such as when state-level unemployment insurance benefits are generous, and workers are more able to consider outside options, and because of that, they may be less likely to be motivated to be productive. And firms are less likely to offer health insurance when external frictions are high, such as when unemployment benefits are minimal, and workers are more likely to stay put and are more motivated to keep their jobs by working harder. The researchers used a quasi-experimental approach to examine firms' provision of health insurance benefits in response to exogenous changes in state-level UI benefits. They found that with higher UI benefits, firms were more likely to offer health insurance to their employees. They also found that these investments paid off in terms of better worker retention, productivity, and profitability. Using data from Glassdoor.com, they also found that employee reviews for firms that do offer health insurance have higher job satisfaction ratings than firms that do not, suggesting that increases in productivity may come from workers being happier in firms with health insurance. In the context of the ongoing Great Resignation and labor shortages, the challenges in attracting and retaining workers has taken center stage. The provision of health insurance is a major financial and strategic decision. Because small firms employ 46% of the labor force in the US, understanding the variation in healthcare provision has far-reaching implications for the US economy.